Hey, Dr. Libby here. A question I commonly get in my practice is, should I eat gluten? And my general answer is, I don't think gluten is great for anybody, but there are three groups of people who should strictly avoid it. So those people are people who have celiac disease. Celiac disease is an autoimmune disease where your body reacts to gluten and it actually damages the cells of the small intestine. So people with gluten disease need to strictly avoid gluten. I also think anyone with any autoimmune disease should strictly avoid gluten. It can elicit immune response, which can create inflammation, and eliminating gluten can have a profound effect on the healing of other autoimmune diseases, things like Hashimoto's thyroiditis, rheumatoid arthritis, type 1 diabetes, Sjogren's syndrome, Crohn's disease, ulcerative colitis. All of these can improve with limiting gluten. There's also a huge segment of the population who has what's called non-celiac gluten sensitivity. So these people don't have celiac disease, but do react to gluten and they feel much better when eliminating gluten. So I recommend being at least gluten light. Gluten definitely causes inflammation in most people. So avoiding gluten as much as you possibly can is probably going to help you feel better. But if you're in one of those three categories, you should avoid it as much as possible. For anyone with autoimmune disease, I recommend three things. One is eliminating gluten, like we just talked about. Two is cleaning up the gut, healing the gut and getting rid of the bad gut bacteria and optimizing the good gut bacteria can have a profound effect on autoimmune disease. And then I also recommend taking some sort of an immunomodulatory agent. In my private patients, I often prescribe LDN, low dose naltrexone. But sometimes before trying that, I try an immune supporting supplement. I have one in my store called Immune System Support. It really should be called Autoimmune System Support because that is exactly who I use this for. The dose of this can be one pill twice per day, up to two pills twice per day. This, along with eliminating gluten and cleaning up the gut, can have a profound effect on autoimmune disease. Your body is designed to feel amazing, and it's never normal for your immune system to be attacking your own body. There's always a reason that needs to be identified and can be reversed. My daughter has Hashimoto's thyroiditis, or I should say, had Hashimoto's thyroiditis. She had elevated antibodies, and with following the exact protocol that I just shared, we were able to reverse those antibodies down to zero, and we were able to catch it and treat it and fix it before her thyroid function even diminished. So that's a total win. And that's exactly what we do in functional medicine, identify problems and reverse them as naturally as possible. I hope this helps. Have a great day.